President, skyrocketing drug prices are crippling far too many American families. The Kaiser Family Foundation found that nearly 8 in 10 Americans believe the cost of their prescription drugs is too high and that Congress should work to lower the price of medication that people need. This should be our top health priority for 2017, lowering drug prices and costs for hardworking families, not taking health care away from Americans with no plan to replace it. Think about that. This Congress is hell-bent, instead of attacking one of the major causes of health care inflation, and we've done a good job the last 10 years, by and large, of keeping prices from going much higher than they would have otherwise. Keep that in mind while we hear the generally specious arguments against the Affordable Care Act. But instead of doing that, the majority party here has fallen all over itself to try to take away health insurance from 900,000 people in my state, take away from 1 million seniors the Medicare consumer protections and Medicare services of preventive care, osteoporosis screening, diabetes screening, physicals, all that their doctors order, taking away from 100,000 young people the ability to stay on their parents' health care plan, and stripping from virtually all Ohio citizens the consumer protections of denying people coverage because they have a pre-existing condition, cutting people off their insurance policy because they just happen to get too sick and might have cost the insurance companies too much money. This health care coverage that has saved 24,000 American lives each year since 2014. Just think what could happen if we took away their health coverage. Instead, lowering drug prices should be something we could come together on. Americans of all political parties and Americans that don't even bother voting are all facing sky-high pharmacy bills. There are concrete actions we can take right now to lower the cost of prescription drugs. Senator Franken and I led 18 of our colleagues in outlining 5 of them in a letter to the president-elect in December, including putting an end to abusive price gouging, requiring more transparency from drug companies, boosting competition and innovation in the market, and allowing the Secretary of Health and Human Services to negotiate better prices for seniors. That's what we do with the Veterans Administration. The VA, on behalf of 7 million veterans, negotiates directly with the drug companies to get a significantly better price for the cost of drugs. Saves taxpayers, saves veterans. Medicare should do the same thing. Senator Klobuchar and I work with several of our colleagues to reintroduce the Medicare Prescription Drug Price Negotiation Act. Negotiating better prices for seniors will save taxpayer dollars, significant taxpayer dollars. But instead of focusing on the priorities that the vast majority of Americans agree on, Congress and President-elect Trump are working to throw 30 million Americans, some 900,000 Ohioans, off their health insurance with no plans to replace it. It's reckless, it's dangerous, it will cause premiums to skyrocket, it will cause costs to go up for everyone, but you know what it does? It gives a $30 billion tax break to drug companies and tens of billions of dollars in tax cuts to the richest Americans. So, on the one hand, Congress won't do anything about drug prices because the pharmaceutical industry, frankly, gave too much money to far too many of my colleagues. On the other hand, this same Congress is going to strip away health care and consumer protections to seniors and Medicare and people of all ages, and at the same time giving a tax break to the drug companies. We must fight against these attempts to decrease coverage, to weaken consumer protections, to increase costs in working families. Whether you support the Affordable Care Act or not, we can all agree that you can't ask people to change horses midstream without giving them a second horse. Last week, I spoke with one of my constituents, Kathy, who wrote to my office last November with the heartbreaking story of her husband, Lee. He's fighting stage 4 cancer. Before 2010, insurance companies denied Kathy and her family the family coverage she needed because her husband's cancer was a pre-existing condition. Thankfully, the Affordable Care Act stopped insurance companies from abusive practices like this. It allowed Kathy's family to buy health insurance through the marketplace, helping them afford the care he needs to fight this devastating disease. Still, like so many Ohio families, Kathy continues to struggle to afford the prescription medicines that she and her husband need. She fears that what will happen if families like hers are simply kicked off their insurance. Imagine 900,000 Ohioans with insurance, and like that, because of partisan politics here, because so many of my colleagues ran for president in some cases, or ran for Senate, or ran for House by saying they're going to get rid of the Affordable Care Act, and they're going to get rid of it and not replace it for a couple of years maybe. Governor Kasich, Republican governor in my state, also in the presidential race with my friend, the presiding officer's chair, has said to the Senate and the House, to Ohio's Republican members, don't cancel the Affordable Care Act. Don't throw people off insurance unless you're going to replace it with something right now that will take care of those people. 700,000 people in Medicaid expansion, another 100, 200,000 people, 26-year-olds in their parents' plan, people in the exchanges, people getting insurance in other ways. Now, when I was talking to Kathy the other day, she was choked up talking about the stress and heartache dealing with a loved one with cancer, how she can't even bear the thought of adding more insurance worries on top of that. So I was speaking to a hospital administrator today at one of Ohio's great hospitals, and he said he thinks what this Republican Congress is going to do in the Affordable Care Act is morally reprehensible. And he said, you know, how do I explain to people right in the middle of their treatment that we can't do it anymore because we don't have the resources if the Affordable Care Act is repealed and the insurance is canceled and the Medicaid expansion is gone and hospitals can't take care of everybody like they are pretty much now. How do I explain to somebody right in the middle of cancer treatment, right in the middle of another kind of long-term or short-term illness, that their insurance has been cut off? Instead of kicking people off their insurance with no plan to replace it, and handing billions of dollars in tax breaks to the drug companies, let's make our first priority lowering drug costs for the people whom we say we are serving.